What if I told you that the reason your erections aren't as strong as they used to be may have nothing to do with getting older? What if the real problem is that your body is quietly running low on one essential vitamin that millions of men over the age of 60 don't even realize they're missing? Every week, I meet men who tell me the same story. They assume weaker erections, lower energy, and declining confidence are simply the price of aging. So they spend hundreds of dollars on expensive supplements, herbal remedies, and miracle products they find online. Yet many never address one of the most common and overlooked causes that may be affecting their overall health. The truth is, healthy erections depend on healthy blood flow, properly functioning nerves, balanced hormones, and good cardiovascular health. And one vitamin plays an important role in supporting many of these systems. While it isn't a miracle cure and it won't replace medical treatment when it's needed, maintaining healthy levels of this vitamin may help support your overall health, including the systems that contribute to normal erectile function. In today's video, I'll explain what this vitamin is, why so many men over 60 become deficient without realizing it, the warning signs you should never ignore, the best natural sources, and the simple daily habits that may help support healthy levels. Stay with me until the end, because I'll also reveal one common mistake that quietly increases the risk of deficiency, and most men are doing it every single day without even knowing it. Welcome back. I'm Dr. Merita, and today we're going to discuss a health topic that many men think about, but very few feel comfortable talking about: why erections often become weaker with age, and whether there's anything you can do to naturally support your sexual health. If you're over the age of 60 and you've noticed that your erections aren't as firm as they once were, take longer to achieve, or don't last as long as they used to, you're certainly not alone. Millions of men experience these changes every year. While aging does bring natural changes to the body, it's important to understand that getting older doesn't automatically mean losing your sexual health. In many cases, erectile difficulties are influenced by factors such as blood vessel health, hormone balance, nerve function, chronic medical conditions, and even nutritional deficiencies. One nutrient that often receives far less attention than it deserves is vitamin D. Most people think of vitamin D as something that's only important for strong bones, but research has shown that it plays a much broader role throughout the body. Vitamin D helps support healthy muscles, immune function, cardiovascular health, and may also contribute to healthy testosterone levels and normal blood vessel function. Because healthy erections depend on good circulation and healthy blood vessels, maintaining adequate vitamin D levels may be one important piece of the puzzle. Unfortunately, vitamin D deficiency becomes increasingly common as we grow older. As we age, our skin becomes less efficient at producing vitamin D from sunlight. Many older adults spend less time outdoors, and certain medical conditions or medications can further reduce vitamin D levels. The problem is that deficiency often develops silently. Many men don't realize they have low vitamin D until they begin experiencing symptoms such as fatigue, muscle weakness, reduced physical performance, low mood, or other health concerns. It's important to be clear from the beginning that vitamin D is not a miracle cure for erectile dysfunction. If you're experiencing persistent erectile problems, it's essential to speak with your healthcare provider, because conditions such as diabetes, cardiovascular disease, high blood pressure, medication side effects, hormonal disorders, or psychological factors may also be involved. However, if you're deficient in vitamin D, correcting that deficiency may help support your overall health and improve the body's ability to function the way it's designed to. Throughout this video, I'll explain why vitamin D is so important for men's health, the warning signs that may suggest your levels are low, the best natural sources of vitamin D, the daily habits that may quietly be lowering your levels, and the situations where it's important to seek medical advice rather than trying to solve the problem on your own. Let's begin by understanding why so many men over the age of 60 experience changes in erectile function, and why healthy blood flow remains the foundation of healthy erections. Before we reveal the vitamin itself, it's important to understand why erections often become weaker as men get older. One of the biggest misconceptions I hear from patients is, "Doctor, it's just my age." While aging certainly brings changes to the body, Age itself isn't usually the direct cause. More often, it's the gradual changes happening inside your blood vessels, hormones, nerves, and overall health that make the difference. A healthy erection begins long before any physical response. It starts in the brain. When a man becomes sexually aroused, the brain sends signals through the nerves, telling the blood vessels in the penis to relax and widen. This allows a large amount of blood to flow into the erectile tissue, creating a firm erection. If blood flow is reduced, nerve signals are weakened, or the blood vessels can't expand properly, erections may become less firm, more difficult to achieve, or shorter lasting. One of the first systems affected by aging is the cardiovascular system. Over the years, cholesterol deposits, high blood pressure, diabetes, smoking, and chronic inflammation can slowly damage the lining of your blood vessels. Because the arteries supplying the penis are much smaller than those supplying the heart, they often show signs of poor circulation much earlier. In fact, many healthcare providers consider persistent erectile dysfunction to be an early warning sign that a man's cardiovascular health deserves closer attention. I remember a patient named David, a 65-year-old retired electrician, who came to my office convinced that his sexual health was simply disappearing because he had reached retirement age. He had tried several supplements he found online, but nothing seemed to help. After a complete evaluation, we discovered that his blood pressure was elevated, his cholesterol levels were higher than recommended, and he rarely spent time outdoors. His problem wasn't caused by one single issue. It was the result of several health factors working together. Once we focused on improving his overall health, instead of chasing miracle solutions, he began feeling more energetic, slept better, and gradually noticed improvements in his confidence as well. This is why I always encourage men to stop thinking of erectile health as an isolated problem. Healthy erections are closely connected to the health of your heart, your blood vessels, your hormones, your muscles, and even your immune system. When one part of that system begins to struggle, the effects are often felt throughout the body. That brings us to today's topic. There is one vitamin that quietly supports many of these systems at the same time. It plays an important role in maintaining healthy muscles, supporting blood vessel function, helping the immune system, and even contributing to normal testosterone production. Yet millions of older adults don't get enough of it. In the next section, I'll explain why vitamin D has become one of the most talked about nutrients in men's health, and why so many men over 60 may be deficient without even realizing it. Now that we understand how healthy erections depend on healthy blood flow, let's talk about the nutrient that many experts believe deserves far more attention: vitamin D. Most people think of vitamin D as the bone vitamin. They associate it with preventing osteoporosis or keeping bones strong. While that's certainly true, what many people don't realize is that vitamin D receptors are found throughout the body, including in blood vessels, muscles, the immune system, and even reproductive tissues. This tells us that vitamin D does much more than protect your bones. One of the reasons vitamin D has attracted so much attention in men's health is its relationship with the cardiovascular system. Healthy blood vessels need to remain flexible so they can expand and allow adequate blood flow when it's needed. Vitamin D appears to play a role in supporting normal blood vessel function and reducing excessive inflammation. Since erections rely heavily on healthy circulation, maintaining adequate vitamin D levels may indirectly support the body's natural ability to achieve normal erectile function. Vitamin D may also help support healthy testosterone levels. Testosterone naturally declines with age, and while vitamin D isn't a replacement for hormone therapy or a guaranteed way to raise testosterone, some studies have found that men with adequate vitamin D levels tend to have healthier testosterone levels than those who are deficient. This doesn't mean taking large doses of vitamin D will suddenly restore youthful hormone levels, but correcting a deficiency may help support normal hormonal balance as part of an overall healthy lifestyle. Another important role of vitamin D is supporting muscle strength and nerve function. Remember, an erection isn't only about blood flow. It also requires healthy nerve signals between the brain and the body, along with properly functioning muscles in the pelvic region. When these systems are working together, the body is better able to perform as it should. What surprises many of my patients is just how common vitamin D deficiency has become. After the age of 60, the skin becomes much less efficient at producing vitamin D from sunlight. Many older adults spend less time outdoors than they did in earlier years. Some wear protective clothing or sunscreen throughout the day, which is important for skin health but also reduces vitamin D production. Certain digestive disorders, kidney disease, obesity, and even some medications can further increase the risk of deficiency. I remember a 69-year-old patient named Michael who came to see me because he was experiencing constant fatigue, reduced physical strength, and a noticeable decline in his sexual confidence. He assumed everything was simply part of getting older. During his medical evaluation, routine blood tests showed that his vitamin D level was well below the recommended range. After working with his primary care physician to safely correct the deficiency and improve his overall lifestyle, including regular walking, healthier eating, and spending appropriate time outdoors, he didn't just report feeling stronger physically. He also told me his energy improved, his mood lifted, and he felt more like himself again. While we can't say vitamin D alone caused those improvements, correcting the deficiency became one important part of restoring his overall health. The key message here is simple. Vitamin D is not a miracle cure for erectile dysfunction, but if your body is lacking this essential nutrient, you're asking your blood vessels, muscles, nerves, and hormones to function without one of the tools they need. Supporting healthy vitamin D levels may not solve every problem, but it can be an important step toward improving your overall health and, in some cases, supporting the systems involved in normal sexual function. The next question is even more important. How do you know if your vitamin D levels might already be too low? The warning signs are often subtle, and many men mistake them for nothing more than getting older. Let's look at those signs next. One of the biggest problems with vitamin D deficiency is that it usually develops slowly. Unlike a sudden illness, it doesn't announce itself overnight. Instead, the symptoms often appear so gradually that many men simply blame them on getting older. They tell themselves, "I'm just not as young as I used to be," when in reality, their body may be trying to tell them something important. The first sign many men notice is a steady decline in energy. You may wake up feeling tired even after a full night's sleep. Activities that once felt effortless, walking around the neighborhood, working in the yard, or climbing a flight of stairs, suddenly leave you feeling exhausted. While many conditions can cause fatigue, low vitamin D is one possible contributor that should not be overlooked. Another common warning sign is muscle weakness. Vitamin D plays an important role in normal muscle function. When levels are too low, muscles may not perform as efficiently. Some men describe feeling less stable when walking, having difficulty standing up from a chair, or noticing that their legs simply don't feel as strong as they used to. These changes can also increase the risk of falls, especially later in life. Low mood is another symptom that often surprises people. Vitamin D receptors are present in areas of the brain involved in mood regulation. Some men with low vitamin D report feeling less motivated, less interested in activities they once enjoyed, or simply not feeling like themselves. While depression has many possible causes and should always be evaluated by a healthcare professional, correcting a vitamin D deficiency may be one helpful part of an overall treatment plan when deficiency is present. Poor sleep is another clue. Many older adults with low vitamin D report restless nights, frequent waking, or feeling unrefreshed in the morning. Since good sleep is essential for hormone production, cardiovascular health, and sexual function, poor sleep can create a cycle that affects many aspects of your well-being. Then there's the symptom that brings many men into my office: changes in sexual health. If your erections have become weaker, less frequent, or harder to maintain, it's important not to assume that vitamin D is the only cause. Erectile dysfunction can be related to diabetes, heart disease, high blood pressure, hormonal changes, medication side effects, stress, or other medical conditions. However, if you're also experiencing fatigue, muscle weakness, low mood, and limited sun exposure, vitamin D deficiency is certainly something worth discussing with your healthcare provider. I remember a patient named Richard, a 71-year-old grandfather, who believed he was simply slowing down. He had stopped taking his daily walks because he felt tired all the time. His muscles felt weaker, his confidence had faded, and his interest in intimacy had declined. After a comprehensive medical evaluation, his blood work revealed a significant vitamin D deficiency. Working together with his physician, he safely corrected the deficiency while also improving his diet, increasing his physical activity, and spending more time outdoors. Over the following months, Richard told me he felt more energetic, slept better, and regained the motivation to return to many of the activities he loved. While no single change explained all of his progress, addressing his vitamin D deficiency became an important step toward improving his overall health. The good news is that vitamin D deficiency is relatively easy to detect with a simple blood test ordered by your healthcare provider. Rather than guessing or taking large amounts of supplements on your own, it's always better to know your actual vitamin D level and develop a plan that's appropriate for your individual health needs. So, if these warning signs sound familiar, the next question becomes obvious. How can you naturally support healthy vitamin D levels without relying solely on supplements? In the next section, I'll show you the safest and most effective ways to do exactly that. Now that we've talked about the warning signs, the next question is one I hear almost every day. Doctor, how can I naturally improve my vitamin D levels? The good news is that for many people, healthy habits can make a meaningful difference. The key is to focus on safe, consistent lifestyle changes rather than searching for quick fixes. The first and most natural source of vitamin D is sunlight. When your skin is exposed to sunlight, your body begins producing vitamin D on its own. However, as we age, this process becomes much less efficient. A 65-year-old man simply doesn't produce vitamin D as effectively as he did when he was 25. That's one reason deficiency becomes so common after the age of 60. If your healthcare provider says it's appropriate for you, spending a short amount of time outdoors several days a week may help support healthy vitamin D production. The exact amount of sun exposure varies depending on your skin tone, location, season, and weather, so it's important to avoid excessive sun exposure that could increase the risk of skin damage. Balance is always the goal. Food is another important source, although it's difficult to get all the vitamin D your body needs through diet alone. Fatty fish such as salmon, sardines, trout, and mackerel are among the richest natural sources. These foods also provide heart-healthy omega-3 fatty acids, making them an excellent choice for men concerned about both cardiovascular health and sexual function. Egg yolks can also contribute small amounts of vitamin D, along with high-quality protein that helps maintain muscle strength as we age. Fortified dairy products and fortified plant-based milks often contain added vitamin D as well, making them another practical option for many older adults. Some mushrooms exposed to ultraviolet light also contain vitamin D and can be a helpful addition to a balanced diet. I often remind my patients that no single food works like medicine. Instead, it's the combination of healthy choices that supports better health over time. A breakfast that includes eggs, a glass of fortified milk, and fresh fruit is far more beneficial than relying on processed foods that offer little nutritional value. For some men, healthy eating and sunlight still aren't enough. Medical conditions affecting the kidneys, digestive system, or liver can reduce the body's ability to absorb or activate vitamin D. In these situations, your healthcare provider may recommend a vitamin D supplement based on your blood test results. This is why I never advise taking high-dose supplements without first knowing your vitamin D level. More is not always better. Excessive vitamin D can cause serious health problems, including elevated calcium levels, kidney stones, nausea, confusion, and, in severe cases, kidney damage. I remember one patient, Thomas, a 73-year-old retired teacher, who assumed that if a small amount of vitamin D was good, then taking several large doses every day would be even better. Fortunately, his routine blood work revealed that his vitamin D level had become much higher than recommended. We adjusted his supplementation under the guidance of his primary care physician, and his blood levels gradually returned to a healthy range. His experience is an important reminder that even vitamins should be taken responsibly and under medical supervision when supplements are needed. The goal isn't to chase the highest vitamin D level possible. The goal is to maintain a healthy level that allows your body to function properly. Combined with regular physical activity, a balanced diet, quality sleep, and good management of chronic conditions such as diabetes or high blood pressure. Maintaining adequate vitamin D may help support the systems involved in healthy aging, including the blood vessels and muscles that contribute to normal erectile function. But even if you're getting enough vitamin D, there's another problem many men overlook. Certain everyday habits can quietly work against you, lowering your overall health and making it much harder for your body to perform at its best. Let's look at those habits next. Even if you're getting enough vitamin D, there's another piece of the puzzle that many men completely overlook. Every day, certain habits may quietly damage your blood vessels, reduce hormone balance, and interfere with the body's ability to maintain healthy sexual function. The surprising part is that many of these habits have become so common that people rarely question them. The first is spending too much time sitting. As we get older, it's easy to become less active, especially after retirement. Hours spent watching television, working at a desk, or sitting in a favorite chair may not seem harmful, but prolonged inactivity can reduce circulation throughout the body. Healthy blood flow is essential not only for your heart and brain, but also for normal erectile function. Even something as simple as a 30-minute walk most days of the week can support cardiovascular health and improve circulation. The second habit is poor sleep. Many men underestimate how important sleep is for overall health. During sleep, your body repairs blood vessels, regulates hormones, and supports countless biological processes. Chronic sleep deprivation has been linked to lower testosterone levels, increased inflammation, higher blood pressure, and reduced energy. If you're sleeping only 4 or 5 hours each night, your body may struggle to function at its best. Another major factor is smoking. Cigarette smoke damages the inner lining of blood vessels, making it more difficult for them to expand properly. Over time, this reduces blood flow throughout the body, including to the penis. In fact, smoking is one of the strongest lifestyle-related risk factors for erectile dysfunction. The good news is that quitting smoking can improve circulation and provide benefits for your heart, lungs, and overall health at any age. Excessive alcohol is another habit worth mentioning. While an occasional drink may not be harmful for most people, regularly consuming large amounts of alcohol can interfere with hormone production, affect nerve function, disturb sleep quality, and contribute to erectile difficulties. Moderation is key, especially for men already dealing with cardiovascular disease, diabetes, or high blood pressure. Baby weight also plays a significant role. Excess body fat, particularly around the abdomen, is associated with increased inflammation, insulin resistance, lower testosterone levels, and reduced cardiovascular health. Losing even a modest amount of weight through healthier eating and regular physical activity can have meaningful benefits for energy, mobility, and overall well-being. I also encourage my patients to pay attention to chronic medical conditions. High blood pressure, diabetes, high cholesterol, and heart disease often develop quietly over many years. These conditions can damage blood vessels long before obvious symptoms appear. In many cases, erectile dysfunction becomes one of the earliest warning signs that the cardiovascular system needs attention. That's why regular medical checkups are so important. Even if you feel relatively healthy, stress deserves attention as well. Ongoing stress increases the production of cortisol, a hormone that can interfere with normal testosterone production, disrupt sleep, raise blood pressure, and reduce sexual desire. Finding healthy ways to manage stress, whether through walking, spending time with family, hobbies, meditation, or simply taking time to relax, can positively affect both your physical and emotional health. One of my patients, James, a 68-year-old grandfather, was convinced he needed another supplement to solve his erectile problems. But after reviewing his daily routine, we discovered he slept less than 6 hours a night, rarely exercised, smoked half a pack of cigarettes a day, and spent most afternoons sitting indoors. Rather than focusing on one pill or one vitamin, we worked on improving these daily habits step by step. Over several months, he lost weight, became more active, slept better, and quit smoking. His energy improved, his blood pressure became easier to control, and he told me he felt healthier than he had in years. His progress wasn't the result of one miracle solution. It came from improving the overall health of his body. The lesson is simple. No vitamin can fully overcome unhealthy daily habits. Vitamin D may support your health, but it works best when combined with regular exercise, quality sleep, balanced nutrition, avoiding tobacco, limiting alcohol, and properly managing chronic medical conditions. These lifestyle choices work together to protect your blood vessels, support healthy hormone function, and improve the foundation of good sexual health. In the final section, I'll show you a simple daily routine that brings all of these healthy habits together, one that many men over 60 can realistically follow to support their overall health, energy, and vitality. Now let's bring everything together with a simple daily routine that supports not only healthy vitamin D levels, but also your heart, blood vessels, muscles, and overall well-being. The goal isn't to completely change your life overnight. The goal is to build small, consistent habits that your body can benefit from every single day. Start your morning by getting outside if possible. After waking up, spend a little time walking outdoors or simply sitting in the morning sunlight if it's appropriate for your skin type and local weather conditions. This isn't just about vitamin D. Morning light also helps regulate your body's internal clock, which can improve sleep quality later that night. Next, choose a breakfast that supports your overall health. Instead of processed pastries or sugary cereals, focus on foods rich in protein and healthy fats. Eggs, fortified dairy products, oatmeal with nuts, fresh berries, or whole grain toast can provide lasting energy while supporting muscle health and cardiovascular function. After breakfast, make movement part of your routine. You don't have to spend hours in the gym. A brisk 30-minute walk, light cycling, swimming, or simple resistance exercises performed a few times each week can help improve circulation, maintain muscle mass, support healthy blood pressure, and keep your body functioning more efficiently. Even gentle stretching can improve flexibility and reduce stiffness. Hydration is another habit many men underestimate. As we age, our sense of thirst naturally declines, making dehydration more common. Drinking enough water throughout the day supports circulation, kidney function, and overall health. While water alone won't improve erectile function, staying properly hydrated helps every system in your body perform more effectively. Throughout the day, fill your meals with colorful vegetables, fruits, lean proteins, healthy fats, and whole grains. These foods provide antioxidants, vitamins, minerals, and fiber that help reduce inflammation and support healthy blood vessels. At the same time, try to limit highly processed foods, excessive sugar, and large amounts of saturated fat, which may contribute to cardiovascular disease over time. Don't forget about your mental health. Don't forget about your mental health. Chronic stress doesn't only affect your mood, it can also influence blood pressure, sleep, hormone balance, and sexual health. Make time for activities you enjoy, whether that's gardening, reading, fishing, spending time with family, or simply taking a quiet walk. A healthy mind supports a healthy body. Finally, make quality sleep a priority. Aim for 7 to 8 hours of restful sleep whenever possible. During sleep, your body repairs tissues, regulates hormones, supports immune function, and restores energy. Good sleep is one of the most powerful and often overlooked tools for healthy aging. I often think about one of my patients, Harold, who was 72 when he first visited my office. He wasn't looking for a miracle pill. He simply wanted to feel like himself again. Rather than focusing on one single problem, we worked on improving his overall health. He began walking every morning, spent more time outdoors, ate a more balanced diet, improved his sleep habits, and followed his physician's recommendations for managing his vitamin D levels and blood pressure. 6 months later, Harold told me something I'll never forget. He said, "Doctor, I don't just feel healthier. I feel younger because I finally have the energy to enjoy my life again." That transformation didn't happen because of one vitamin. It happened because of consistent, healthy choices made day after day. That's the most important message I want you to remember today. Vitamin D can be an important part of maintaining good health, especially if you're deficient, but it works best as part of a complete healthy lifestyle. When you combine proper nutrition, regular physical activity, quality sleep, stress management, and appropriate medical care, you're giving your body the best possible chance to stay strong, active, and healthy for years to come. In just a moment, I'll leave you with the most important takeaway from today's discussion and one simple step you can take starting today to support your long-term health. As we come to the end of today's discussion, I want you to remember one important message. Weaker erections are not always an unavoidable part of aging. In many cases, they're a sign that your body is asking for attention. Your blood vessels, hormones, nerves, and overall health all work together. And when one part of that system begins to struggle, your sexual health may be one of the first places you notice it. We also learned that vitamin D is far more than just a nutrient for healthy bones. It plays an important role in supporting muscle function, immune health, and normal blood vessel function. While vitamin D is not a cure for erectile dysfunction, maintaining healthy levels may support the body's overall health, especially if a deficiency is present. For many older adults, simply identifying and correcting a deficiency under the guidance of a healthcare professional can become one valuable step toward feeling stronger, more energetic, and more confident. Remember the warning signs we discussed today. Persistent fatigue, muscle weakness, poor sleep, low mood, and declining physical performance shouldn't automatically be dismissed as just getting older. They may have many different causes, including vitamin D deficiency, and they deserve a proper medical evaluation rather than guesswork. The best approach is always a combination of healthy habits. Spend appropriate time outdoors when possible, eat a balanced diet that includes natural sources of vitamin D, stay physically active, maintain a healthy weight, avoid smoking, limit excessive alcohol, manage chronic medical conditions, and make quality sleep a priority. These daily choices don't just support sexual health. They help protect your heart, brain, muscles, and overall quality of life. If there's one action I'd encourage you to take after watching this video, it's this. Schedule a routine checkup with your healthcare provider and ask whether checking your vitamin D level is appropriate for you. A simple blood test can provide valuable information and help determine whether your body is getting what it needs. Instead of guessing or relying on internet advice, you'll have a plan that's based on your individual health. Your body has an incredible ability to respond when you give it the right support. Small improvements, repeated consistently over time, often produce results that are far more meaningful than any miracle product or quick fix. Thank you for spending these few minutes with me today. I truly hope this information has helped you better understand your health and given you practical steps you can begin taking right away. Remember, it's never too late to invest in your health, your confidence, and your future. The choices you make today can have a lasting impact on how you feel tomorrow. If you found today's video helpful, I'd really appreciate it if you gave it a thumbs up. It helps more men discover reliable, science-based health information instead of misleading myths and miracle cures. If you're new here, be sure to subscribe and turn on notifications so you never miss our weekly videos on prostate health, erectile function, testosterone, nutrition, and healthy aging. My goal is to help you make informed decisions that support your health and confidence as you get older. I'd also love to hear from you. In the comments below, tell me your age and the country you're watching from. And let me know this one thing. Have you ever had your vitamin D level checked? Your experience could encourage another man to take an important step toward improving his own health. As always, remember that the information in this video is intended for educational purposes and should never replace personalized medical advice. If you're experiencing persistent erectile dysfunction or any concerning symptoms, please speak with your healthcare provider for a proper evaluation. Thank you so much for watching. Take care of yourself, stay active, stay healthy, and I'll see you in the next video.